Good morning, students. Today we are going to take the revision of the proprietary names. This is the individual name selected and used by the manufacturer. If the drug is manufactured by more than one company, each firm assigns its own proprietary names. It should be written such that the first letter of each word of the name is in the capitals. Example is the aspirin, which is acetyl salicylic acid, is marked under the different trade names like Disprin, Ecosprin, Espro, Anacin, etc. What is pharmacopoeia? Explain its importance. Pharmacopoeia means pharmacon, a drug, and poeia means to make. The pharmacopoeia is the direction and the requirements for the preparation of the medicine. It is the legislations of the country. It set standard and obligatory quality indices for the drug raw material used for the pharmaceutical preparations. Next, synthesis part we have covered in the last lectures. Now the narcotics and non-narcotics we have covered in the last lecture. Chemical group salicylic acid we have covered in the last lectures. What is the mechanism of the release of the histamine? Mechanism of release of histamine, mention its any two physiological actions. Mention its any two physiological action. Histamine is the 2-imidazolyl ethanamine. It is the tissue amines and is obtained by the decarboxylations of the amino acid histidine. Histamine is widely distributed in the nature and is mainly present in the organs and tissue of the human body. Histidine and histamine. 5-member nitrogen containing ring having the CS2 CHCOS NH2. Heating, decarboxylation takes place. COS converted into CS2 CH2 NH2. Next is the histamine is released during the allergic and anaphylactic manifestation caused by the sensitizing the antigen present in the food, pollen grains, or through the environmental factors. Histamine produces the wide variety of physiological actions like strong vasodilation of the capillaries and increase the permeability, thus resulting in the accumulation of the fluid in the body, causing edema. On the smooth muscles of the lungs, it produces the bronchoalveolar constriction. It has stimulatory actions on the certain excretory glands, causing an increase in the secretion of the acids in the stomach. On the uterus, it causes the constriction actions. Lacrimal and nasal secretory glands are also stimulated. Histamine play an important part in the human allergy since the skin reactions produced by the intradermal injections of histamine is similar to the allergic skin reactions like urticaria, dermatitis, confirming thereby that the allergic reactions are due to the release of the histamine. Hence, agents capable of blocking the actions of the histamine are known as antihistamines. Write a note on N-aryl anthanilic acid, mefenamic acid, This is the structure of mefenamic acid. Mefenamic acid is the anthranilic acid derivative, whereas 2,3-xylyl group is substituted at nitrogen atoms. It is used as a mild anti-inflammatory agent and analgesic to give the relief during the tooth extractions. It is also used to treat the inflammation caused by the rheumatic arthritis, acute gout, and the musculoskeletal disorder. The side effect of is caused ulceration in the gastrointestinal tract. What are the cardiovascular drugs? Explain the vasodilators and the antihypertensive drugs. Cardiovascular drugs are the drugs which act directly or indirectly on the heart and blood vessels so as to improve the output of the heart and distribution of the blood to different parts of the circulating system. Vasodilations. Vasodilations. These are the group of the drugs which act primarily on the vascular systems. The therapeutic action of the vasodilators is due to the ability to dilate the coronary blood vessels by relaxing the smooth muscles. This increases the blood flow, which increases the oxygen supply to the heart, arteries. All this offers resistance to the blood flow, thus increasing the blood pressures. Next is the structure, chemical type and uses of atenolol. Atenolol is the phenoxy derivative of non-substituted propylamine. Uses. Atenolol is a beta blocker, that is, it selectively blocks beta receptor present in the heart. It is used in the treatment of angina pectoris and also myocardial infarctions. Explain the term respiratory stimulant. These drugs are stimulate the output of the respiratory tract fluid either directly or by reflex actions. Hence they are of two types: direct stimulants. Certain volatile oils like oil of the eucalyptus, anise, lemon, cedar wood, as well as the alcohol when administered by the inhalation with the steam can increase the secretion in the respiratory tract. Reflex stimulants. These drugs produce the mild irritation of the gastric mucosa, thereby stimulating the gastric reflexes with the help to increase the respiratory tract secretions. Example: lemon, ginger, tea or coffee, which contain the caffeine and the theophylline. What is the Parkinson's disease? Give its two symptoms. It is disease named after the Dr. James Parkinson's. Parkinson's disease is due to the abnormality of the CNS and the malfunction of the lower part of the brain. It mainly causes rigidity in the body, affect the posture, movement and the speech. There are three types of Parkinson's disease: idiopathic paralysis agit, potentiophthalmic Parkinson's, arteriosclerotic Parkinson's. Symptoms: Tremor is the most visible symptoms of this disease. It occurs at rest and it most common in the hands and arms. As the disease progresses, the tremors may affect more of the body and become more pronounced. Rigidity or muscle stiffness result from a shortening of the muscles. This rigidity causes the unstable posture and the acquired guilt. This result in the movement of the limbs. Acute condition, the facial freezes resulting in the mask-like facial expressions. What is diabetes mellitus? How it is related to the insulin? Diabetes mellitus is a chronic metabolic disease caused by the variable combinations of the two pathogenic factors insulin deficiency and insulin resistance. Result in disordered utilization and the storage of the carbohydrate, proteins and fat and reduce the productions of the energy. The different cell of the pancreas produces following compounds. Okay, students, remaining part we will cover in the next lecture. Thank you.